everybody. So I'm going to start out with a really quick announcement for all of you tweeters out there. Make sure you hashtag MUO'Brien when you tweet at today's conference. All right, so good morning. I'm Hannah Kirby, a senior majoring in journalism in the Diederich College of Communication at Marquette University. And I'm here today to introduce our first presenter. This past summer, I had the privilege of interning at the Milwaukee Journal-Sentinel. Anytime I'd tell someone I had been one of Justin George's research assistants, I always got the same reaction. You worked with Justin George? He's the best. Or, I've never met him, but he does amazing work. After spending a year working with Justin, I can attest that these statements were completely accurate. I had the opportunity to accompany Justin on a trip to San Francisco last spring and was in complete awe as he talked with homicide victims' families with the utmost sincerity and compassion. I've never met someone who is so incredibly talented and humble at the same time. I can say Justin is the best, but as a journalist, I'll back it up with the facts. Justin has been a crime reporter at the Baltimore Sun since 2012. He was a contributor to the podcast Serial, and before the Sun, he was at the Tampa Bay Times. Justin George is someone who truly lives life according to his faith and is guided by his values. No wonder he fit in so well at Marquette University. Without further ado, I'd like to introduce you to an amazing mentor, a phenomenal reporter, and my great friend, Justin George.
Wow, that was the nicest thing that anybody said about me in a long time. I can't live up to that, so don't even try. Thank you. First of all, thank you for having me. I want to thank the O'Brien Fellowship and everybody here. It was just such an amazing honor to be part of this fellowship, and I'm hoping that what I have found and the story that I did lives up to essentially the opportunity that I was given. Let me start this. So more than a year ago, actually ever since I've kind of been a crime reporter at the Baltimore Sun, one thing that we noticed as crime reporters almost immediately is that when homicides were being called out by police, they would say where people were shot. And one of the things that we kept hearing repeatedly is, XX was killed in XX block, was shot in the head. Over and over, we heard this shot in the head, and it became something that we even started to track. And looking back, we had known that Baltimore, there's a high number of headshots that go on there, people killed in close range, execution ambushes, things like that, but we wondered why. Why is that occurring? How is that happening? Why are people getting shot in the head so much? Are some of these, criminals, are they trained? Are they training to shoot? What is going on that allows this? So as we tracked it, we still didn't know and trying to figure out, but then, we have more than 200 homicides that happen in the city. Last year, there were more than 340. So, thanks. We didn't really sometimes we don't have time to dig deep to find out what's the underlying causes. But because of the O'Brien Fellowship, I was allowed to sort of dig deep with Hannah and 3 other researchers. We were able to go to different cities like Chicago. We were here in Milwaukee, went to San Francisco, went to LA. Obviously, we were in Baltimore. So, we were able to sort of kind of dig deep and try to figure out what went on. So first of all, when you get shot in the head, a lot of departments don't track that. Baltimore Police kind of does, but not really. So what I had to get at is essentially how lethal are shootings? And so trying to figure that out is something that is fairly, not done. So you have to figure out, first of all, what is lethality and how do we determine it? Now, everybody knows that crime rates are tracked and homicide rates are tracked and homicide counts are tracked. You always hear about that each year, about which is the most, quote unquote, dangerous cities or things like that. That's often based on the number of homicides that occur in a city. But when you try to figure out lethality, which is like how often do people die in shootings, that's something that's kind of unknown. So lethality, again, is just kind of a odd word, is the number of people who die from shootings compared with the total number of people shot. And how it's determined is, or how we were able to sort of determine each city's sort of ratio, is by requesting annual totals from local law enforcement agencies for what police call non-fatal shootings, which are shootings where somebody survives, and gun homicides. We wanted to see where Baltimore stood in lethality compared with other cities. We chose the top 31 cities in the United States by population to make sure we included Baltimore and Milwaukee. And we threw in New Orleans just for good measure because I know that they had, a high number of headshots and obviously quite a bit of homicides. What we found is there's no centralized data on the total number of people shot in the United States. You heard that right. It's unknown how many people are shot each year in the United States. Why is that? Well, police departments don't all track shootings. Just about half of all the departments that we queried don't track non-fatal shootings. Why is that? Because the FBI doesn't require it. The FBI requires that they track homicides, and then there's a category called aggravated assaults. Aggravated assaults can include shootings, when you get shot but survive, but it can also include stabbings, it can include getting beat by a baseball bat, and in many cases, an assault is just pointing a gun at somebody or getting shot at. That's an aggravated assault as well. So what happened is you query all these different departments, you ask them about what their non-fatal shooting statistics is. In a place like Houston, they count a bunch of stuff. So they count, anytime a gun's fired. So they have, it's very difficult to sort of figure out lethality that way. So the sort of thing that I looked at is if you were hit by a bullet and you survived, that's what we wanted. That we wanted to compare that with the total number of people shot, which includes those people who are killed by a gun or essentially shot to death. And that is something that everybody tracks. So when we were able to do that, what we requested was 5 years of data from 2010 to 2015 and 2016, looking at, one, how many people were shot and survived, two, how many gun homicides they had, and just for good measure, total homicides. What we were able to find was that Baltimore had a 1 in 3 ratio, and that means that 1 in every 3 shootings, one person dies. And that is an unbelievable ratio when you think about it. So every time 3 people get shot, 1 person dies. And that was actually up from the previous decade, so it's getting worse, clearly. In other cities, we were only, the 2 others that measured up to that sort of ratio were New Orleans and Washington, D.C. They were also at 1 to 3. In Chicago, we were able to find out that in 2000, there was 1 to 10. The ratio was 1 to 10. So out of every 10 shootings, just 1 person would die. So a lot of people survived. But then now, in 2015, it was 1 to 6. So it's narrowed. So clearly, these shootings are becoming more lethal. A city like Nashville went from 1 to 9 in 2014 to 1 to 4 in 2015. And then in Milwaukee, you had between 1 to 8 and 1 to 9 since 2011. And then it jumped to 1 to 6 in 2015. Detroit, San Francisco, Louisville, and Charlotte also saw lethality increases. So 10 cities of the cities that we were able to get back data from, which again was like half of 31, showed these increases, which is pretty stunning. And it's stunning considering, I'm sure you all heard, there were huge homicide spikes in many urban cities last year. So you would think, and a lot of researchers say that you would expect the shootings to sort of dilute the ratio. If there's a lot more people getting shot, you would expect that the ratio went down. In Baltimore, again, we went from having more than 200 homicides and just quickly jumped to 344. The lethality ratio actually narrowed. It got worse. More people were shot in the head. We found out like 62% were of the gun homicides were people who were shot in the head. Why is that? There's a lot of different reasons. But one of the things that we were able to sort of find out is that there are bigger guns out there on the streets, and they're using more bullets. And how we were able to sort of determine some of that is in Milwaukee a decade ago, the top guns police seized were a 12-gauge shotgun and pistols that cost less than $200 with standard 8-bullet magazines. And these are kind of lower-powered sort of pistols. This year, or which is 2015 actually, the most seized guns were a .40 caliber and a 9mm handguns that cost more than $400 and come with kind of standard magazines that hold between 9 and 16 bullets. So what you saw is these, sort of Saturday night specials is a term that they use, these 22s or cheap guns that were made back in the day, kind of lower caliber, essentially went away. And as the years progress, you have people were using guns that were, again, Glocks, 9mm, things like that in these crimes. In Baltimore, 9mm guns were the top gun seized by police. And a Glock 40 caliber, which is more powerful, was most often used in crimes last year, according to the crime lab. And the number of bullets people fatally shot multiple times, so that's people who have been shot with multiple bullets, increased by a bullet to 5.7 over 10 years. So the people who were killed and shot multiple times, they were shot in an average of 4.7 about a decade ago. That increased to 5.7, but what's even scarier is that bodies that were, and this is from the medical examiner's office in Maryland, bodies that were shot with 5 to 9 bullets or bodies that were shot with 10 or more bullets, both had doubled. In 2015, there was a victim who was shot 38 times. Another thing that we noticed, in Maryland, the ATF's top handgun that was seized was the 9mm. And for the first time, and that was 2015, it surpassed the 22 caliber. So the 9mm is more powerful. It surpassed the 22 caliber for the first time as the most seized gun in 2015 as of the amount of time that the ATF has tracked that data. And in Washington, the former police chief there who just retired, Kathy Lanier, noticed the lethality increases, noticed all the shells that were all over the street. She actually had a seizure picture of a handgun with a ridiculous extended magazine that held 100 bullets. 100 bullets in one gun. And she kept that on her cell phone, and she sort of showed it around to other police chiefs and people about what's going on. So she asked their gun recovery unit to start tracking how many of these extended magazines are being used. On the street, they're called extendos or whatever. So you get a gun, and you find this magazine that has more bullets in it. And they say the reason why is, one, to make sure that your target is dead, and two, if you end up in a shootout, then you have plenty of bullets and you can't get pinned down. So in Washington last year, about 1/3 of guns recovered had high-capacity magazines. That means like more than 10 bullets. Through June of this year, nearly half had large clips. Here's a picture. This is a seizure by Baltimore police. If you look at the magazine there, it's almost, sadly, tragically comical. It is, extremely longer than a foot, as you can tell, and that's going into a handgun. So a lot of times, people have these, they tuck them in their pants. I mean, it's pretty phenomenal when you think about it. That's actual guns that were seized on Baltimore streets. So now you say, well, trauma care has been improving, hospital care has been improving, all these medical advancements have been going on, right? So people clearly, have to be, they're being saved. The lethality rate should go down because of that. Well, we found out that's not the case. In reality is trauma care has been able to save more lives over the years in the cases of falls and car accidents and even stabbings. In all those things, the case fatality rate, as Dr. Hargarten has pointed out, has gone down. But when it comes to gun injuries, they can't keep up. And either, and basically they are watching the case fatality rate either rise or be unchanged. Among some of the studies was in our own, the University of Maryland Shock Trauma Center, which is in Baltimore, studied patients over a dozen years and found that chances for surviving improved significantly in trauma-related injuries except for gunshot victims. In 1999, 9.8% of those patients died. By 2008, that rate had risen to 17%. Johns Hopkins Hospital, also in Baltimore, studied trauma outcomes and found that the fatality rate for patients with gunshot wounds nearly doubled from 9.5% between 2000 and 2003 to 18.3% for the period through March 2005. And if you want to hear about some quotes of what people are saying, this is from Sue Carol Varillo, a nurse manager of the surgical inpatient care unit at Johns Hopkins Hospital. She says, "I never get a single gunshot wound, never." From Elliot Hott, a Johns Hopkins Hospital trauma surgeon, every body organ you can imagine. I had a guy recently, he had different gunshot wounds, probably 10 different wounds in and out, here and there, basically from head to his legs. Then Dr. Thomas Scalia, who's at the Shock Trauma Center and is very world-renowned, we spent every night trying to row upstream against this. At a time when the violence has gotten better in other parts of the country, that doesn't seem to be the case in Baltimore. So again, in Milwaukee, another thing, the chief there, Ed Flynn, has pointed out that the guns are better on the street. Now, I just want to show you sort of a graphic too, and this is what we were able to sort of find in Baltimore, at least. This is from the Baltimore City Crime Lab. So we're looking at essentially the guns that were used most in crime, and if you can see this, these are the guns that were used the most. So we have a Glock 40 here, and look at the cost, which is surprising. I want you guys all to focus on the cost of these guns. This Glock 40 costs about $500. It has a standard capacity of 16 rounds. All of these guns, generally, most of them have a higher capacity. The Smith & Wesson 38 Special costs $539. The Ruger 9mm costs $569. The High Point 9mm costs about $200. The Glock 9mm costs about $500. The Smith & Wesson 40 caliber costs $569, and the Smith & Wesson 9mm costs $569. And this is something that Chief Flynn noticed, is that there are more expensive guns on the street. And he believes that they are actually being bought legally and then somehow ending up in the arms of criminals. So as part of the story, it wasn't just data that we looked at and things like that. It's people. People tell the story, and you want to talk about how this affects people and just the havoc that it wreaks in society. And so we tried to find a bunch of people. We wrote this story in 3 parts, so there are many characters that are spread throughout. It ran 3 consecutive Sundays in the Baltimore Sun. The last part is online today, right now. We were able to talk to Quinzel Covington. He is a hitman, a convicted hitman who took murder for hire contracts on the street. We spoke to him while he's in prison, and he talked about sort of his methods and why he did it and how it works. And you find out, that he uses 2 guns and that he has associates and he uses gloves and he wears a ski mask and he, essentially, ambushes people by studying where they live and things like that. So he basically just kind of, said that there's this sort of niche in Baltimore of these, these hitmen who are there for hire. They're hired by drug dealers to take out other drug dealers. They're hired by women whose fathers haven't provided child support. And in some cases, it's just a family member might want to get rid of somebody who's been in a fight with somebody or things like that. So he claims that, he's been asked to go after like rapists and things like that. So again, he tried to say that he does a good thing out there, which, obviously is clearly not the case, but that's sort of the mindset. He felt that people that he shot deserved to die. Then we have Devontae Turner Ford Bay, a young man in Baltimore. He was shot 27 times and survived, which is just unbelievable. And as he described what happened to him, he's walking down the street. He sees a guy that he sort of knows, an acquaintance. He's wearing a hoodie. He points a gun at him, and it jams. And so he shoots him once, and then it jams. And so he gets shot in the leg, and as he's crawling on the asphalt trying to escape, yelling, he sees the gun unjam, and the guy walks up to him and just keeps walking and shooting and walking and shooting. And so he gets basically on top of him, and he's covering himself, and he's saying, you're good, you got me, please stop. And the guy didn't stop. The clip empties. He's lying there. The guy walks away. Then Devontae figures he must have moved, and the guy puts another clip in the gun, comes back to Devontae, stands on top of him, and starts shooting again. One of the bullets hit his head. It did not go in his skull, but it was able to sort of kind of perforate his skin. And so his mother, who lived nearby, came over and basically dug it out. Amazingly, he survived. And because of this, he admits that he was a drug dealer. He admits that he's been in shootings. In Baltimore, you have a problem of retaliation. And what usually would happen is that he wouldn't talk to police, and him and his boys would sort of gather each other up, and they'd go after this guy. Go after this guy, go after his crew, go after his family, go after everybody. But in this case, he decided, no, I've got kids. I've got 4 or 5 kids. I don't want this to happen. I need this to end. And that's what it takes. It took him, to be brave enough to stop this cycle, to say no more. And that's what it takes. Now, even though he did that, the problem in Baltimore and a lot of cities, but especially in Baltimore, is this no snitching code. And the no snitching code is you do not cooperate with police. You do not, turn in somebody who did something against you or against other people at all. And in Devontae's case, he may have known who had done it, but he was not going to cooperate with police. In his, as he says, in my soul, I can never snitch. It's so prevalent that a lot of times homicide detectives take somebody into the box to interview, and they say, well, what, don't you care about the victim? And the response is, the victim wouldn't want me to snitch. We met Reverend Dorian Coulter. He's a Unitarian pastor who was in this neighborhood of Coldstream, Homestead, Montbello, which was in northeast Baltimore. And what we were able to find out using data again is that it was the most lethal neighborhood in the city. That was it had a ratio of about 1 to 2. And what was going on there is that it's a neighborhood that's in decline, but it has deep roots. And because it has deep roots, a lot of people know each other. And it could be cousins or neighbors. And because they know each other, if you get into a dispute once, the dispute is passionate and very hot. 2, you know where people live, so you're able to plan out if you want to take somebody out. And then 3, you're able to get close to that person because you know them. And thus, if things get to that point, you pull out a gun and you're close by and you're able to obviously shoot and kill that person. The killing there was so prevalent that the neighborhood association there asked Reverend Coulter to be its chaplain. And, essentially what was happening was you had all these families coming to crime scenes, and they didn't know what to do next. They didn't know how to have a funeral. They did not know how to host a vigil. And so Reverend Coulter took it upon himself to guide them through this. And unfortunately, Reverend Coulter, he views this as something that he can't stop. He doesn't think the young people will listen. He wishes they would. So he actually has a very sober message, and actually it is rooted somewhat in reality that he believes that, he has an idea, and his idea is that if you can't get your kids out of the game, if you can't get them off those street corners, buy a life insurance policy for them so that they can get buried properly. Next, we have met Lakia, Missouri, who was twice touched by shootings. In one of the cases, we describe how David Hunter, again, a convicted hitman, had snuck up behind Henry Mills, a man who was walking along, shot him fatally in the head, and then ran. He was convicted of that crime. Well, his wife was Lakia, Missouri, and she went to the hospital, and she's described in the story that's posted today. And when she gets there, he's already gone, and she's asked to identify his body. And as she is brought in to see his body, she sees him, and he looks fine, but then she sees that there's blood dripping, literally from his head onto the ground, and she's asking hospital workers to wipe it up. And I know that's graphic and everything, but that's the reality of what these people see when this thing happens. So she, anyways, puts her life back together, and she's working for the Arc of Baltimore with a lot of disabled people trying to help them. And she essentially meets another man. She's with their boyfriend. They have a child. The child's name is Kendall. Kendall's 3 years old. On the weekends, Dad gets Kendall, and on a specific weekend last month, Kendall was with him, and he was just outside in the kind of early evening. It wasn't a late time, when 3 gunmen show up on the corner and shoot up essentially that area, and 8 people get shot, and one of those is Kendall. So here's this mom who, again, had her husband killed, and now gets her daughter shot in the leg, and she goes through 4 surgeries, and she's still in the hospital as of just last week. She has this giant fixator on her leg. It looks like a scaffolding trying to hold her in place, and it's really sad because this is a young girl who was just finished potty training, picking out her clothes, was figuring out her right from left shoe, and now she has to start over and learn how to walk. And it's pretty crushing for this mother. We have Sala here, Sala Chandler, a mother who in San Francisco who was just so devastated by her son getting killed in a multiple shooting where multiple kids were killed, that she scratched up her car. I don't know if she used a key or what, but she literally scratched her son's name on it, that his case is unsolved, and that somebody needs to do something. I'll have Hannah describe a little bit more of the first time we met her, but she went into action. She was an activist. She protested outside of San Francisco City Hall, and she asked essentially for the city and the police department to raise the amount of money that they give for rewards to turn in a killer. And she was able to do that to $250,000. So she actually got something to happen out of this. You have Cynthia Bruce, a mother who was charged with harassment. In her case, her son, Marcus Downer, was shot 19 times in Baltimore. Everybody saw it on the block, but nobody's providing any information to police. So what does she do is she shows up back there. She knows that the women who were with her son at the time he was shot up on the porch. So she waits outside their house, and whenever they show up, she says, "When are you going to tell police who shot my son?" And their response is, "We already told police, we already cooperated." Well, that wasn't good enough for her. She showed up at their mother's house, where she works at Little Caesar, and said the same thing. And the women eventually charged her with harassment. But that's how desperate she was. The charges were ultimately dropped. But again, this is a woman who feels that police are not doing enough to solve her son's cases. This gap of trust between police and the community is affecting so many people, and in a way, it's deepening that divide between, how people trust what police are doing, whether they're investigating cases or not. And then Shaquem Shabazz, again, is similar. His son, also named Shaquem Gillian, was shot in the head, put on his knees and shot apparently in the head. And again, he can't get any answers, so he wants to hire a private detective. He wants to try to find out who did it. He thinks he knows these guys were involved in other cases, so he wants to get messages to the prosecutor to say, make sure you get these guys, because I'm sure they killed my son. But he's another guy who's looking for answers. You'll hear more about Shaquem. So this is Devontae Ford Bay, the guy who was shot 27 times. Here's some of his wounds. As you can see above his tattoo for his grandmother, Nana, he's got a bullet there. It missed his heart. He had another one that sort of entered here. There's 3 bullet wounds on his thigh. And this is Sala. And you can see that her car is scratched up there. So I'm going to have Hannah come up again and just sort of describe just sort of what Hannah had to do. Was each of these research assistants, I gave them essentially 7 departments to get data from, and they were responsible for that. And then once they did, I asked them to help me find interviews and lock down, people we could talk to, actual victims and things like that. And Hannah was really great about that, and she was able to get Sala and talk to her, and then we were able to sort of meet up with her and do a video interview.
All right, so as Justin said, he assigned each of us 7 or 8 cities. So mine were Dallas, San Jose, Jacksonville, Austin, San Francisco, Indianapolis, Columbus, and Fort Worth. And so what we started out by doing is Justin would give us certain stories to look into. So he gave me a bunch of different stories regarding homicides happening in San Francisco. And I looked through the stories and scouted out the people that were in them. And then I would give the names to Justin, and he would give me a list of the possible phone numbers I could reach them at. So it was a little discouraging. I went through about 50 phone numbers and couldn't find anyone. And eventually I got a hold of Sala. And I was really nervous about talking to a homicide victim's family. I didn't think they would want to talk to me at all. I can't imagine talking to someone about something like that just happened to me. And Sala, right when I started talking to her, you could tell she just wanted the story told to find justice for her son. She was very welcoming. The first time I talked to her for about an hour and a half. like she just wanted her story told. And so I explained the project and what we were trying to do, and I gave Justin her information, and he talked to her, and she was more than willing to meet with us. So we scheduled an interview with her, and then one other family out there, and then Justin also was able to schedule a separate interview. And we went with Sala out in San Francisco. And I was filming the interview, and the entire time we were on the street corner of where her son was shot in the quadruple homicide, and she was just screaming. You can just see the pain in her eyes, and I was following her with the camera. She was looking into it the entire time, and you could just tell how much she was hurting and how much she wanted this to be resolved. And so this was a really, really beneficial experience, like to be able to experience that and work with Justin out there.
So real quick, I want to show you a video that we ran from one of our victims. This is Shakim Shabazz. Again, he's the father that I mentioned.
It's been 2 years since it happened. And it just seemed like yesterday. It doesn't seem like it's been like 2 years. Mentally, it's hard. Some days better than others. Found out I was checking my school inbox on Facebook, and his sister sent me an inbox saying that they found Shakim. So I was like, they found Shakim. I'm like, I didn't know he lost. I just spoke to him. They didn't tell me he was lost somewhere. It was like, they just found Shakim. So I'm like, okay. Then I get a phone call within an hour later from someone in the police department that I know asking me, do I know Shakim Gilliam? I'm like, yeah, that's my son. And they, she told me what happened, but then they found him, in the back of the building and behind the house. They walked him out the car and took him in the back of that, made him get down on his knees, shot him in his head and shot him in his back. Oh. The violence is like, I don't know. I've never seen a situation that is uncontrollable. And what's going on in Baltimore and like other little small cities and urban areas like that is like it's uncontrollable, and it's kind of like outrageous and like unbelievable how people's lives right now has like no value. From other kids getting killed. It's like no one thinks what they're doing. And what people go through afterwards. Everyone thinks about the cause, but never the repercussion of the effect.
So we have about 15 minutes, so without further ado, I have some panelists here that I am so proud to have. These are some amazing people. You have Cheryl Hayes, who's from Chicago. She's a mother and a cousin of homicide victims in Chicago. You have Dr. Stephen Hargarten here. He's professor and chairman of the Department of Emergency Medicine, the Medical College of Wisconsin. And we have Marna Winbush, president and co-founder of Mothers Against Gun Violence, and also the mother of a homicide victim. Have a seat here. So thank you all for being here. At first, I'd like to ask Cheryl, can you just tell the audience a little bit about your son and what occurred? Her case, the case here is unsolved.
His name is Anthony Hayes II. He was a postal employee. He had gotten in his car to go to work, someone, I don't know if they pulled up or ran up beside his car and shot multiple times into the car window on the left, on the driver's side. He was hit multiple times. I don't know how many. Kind of don't want to know how many. And he died on the scene in front of the house. My twin sister, who lives a couple doors down, heard the shots, and she was in the kitchen. And one of the neighbors called and said, well, Anthony usually pulls off and his car is still there. So she said, okay. She put on her, went out to the car, and she said when the closer she got to the car, she said it just didn't look good. And, she found him, and all she could do was just scream and yell, and woke up the whole block, I think. And police came, and the media was there, and they went to the media and they told the media that we don't know, because usually they'll say, oh, he was a documented gang member or something when they do find somebody shot. And the police told them, we don't know. We have nothing on this guy. We just don't know. And I didn't know, I'm baffled, like who could do this? Anthony was a good guy. He loved everyone. He was loved unconditionally, and we were just at a loss, like who could do this? We thought it was, maybe mistaken identity at first, because there was a car in the area that looked like his, and we never saw the driver, so we didn't know if he was hiding out, and they thought it was him, and, so it took a while for us to, they found out, but it took a while for me to kind of come to terms with what they think happened. It's still being investigated, and right now I heard it's going to the Department of Justice, the Attorney General, because of our state's attorney, Lisa Maddox, can't think of her name. She just lost the election, and then the U.S. Attorney's Office had to come in anyway because of the many shootings with the police in Chicago. They've taken control, so they are going to schedule a meeting and have a presentation on what they have. So it's still considered probable cause until they can get, the person and maybe update the charges.
Okay, thank you. Marna, talk about your son and also just briefly kind of, what you went through.
My son was killed in 2003. It was a triple homicide. And the other two young men that he was with, one was just home from college, and he was going back. He was planning on being an NBA basketball star. My son, Deshaun, he was just out. He loved children. He played with children all the time and loved the karate and stuff. And the other guy, Carl, he was down at MATC in college. And when Kurt came home from college, he was disgusted and had problems because he had just broke up with the relationship with the lady that he felt he loved and was going to marry. So when he got here, he went to the bar, which he normally doesn't do, and he met this young lady there named September. And he went out with her a couple of times, and in the midst of him going out with her, he found out she wasn't what he thought she was, that she was a lady of the street. She loved to party and stuff, and that wasn't his lifestyle. And so he told her that they couldn't be together because that wasn't the type of life he wanted to live. And she was the type of lady that had never been rejected by a man. So that did something to her ego. So she went back to the guy that she had formerly was with, and she had got the guy to believe that Kurt was harassing her, bothering her, and in the midst of it, she already had a warrant on this other guy, Ja'Kai Marion, that they wasn't even supposed to be around because they had it out and he was abusing her, she said. And so that night, it was on a Tuesday night, never forget the longest day I lived. It's just like it was yesterday, and it's been 12 years. They went to the bar, and she found out what bar they was at, and she followed them there. And they were shooting pool, so they left that bar and went to another one, not knowing that bartender at the bar that they went to. And so she called Ja'Kai Marion down and act like they were harassing her and bothering her and had him come down. And they said that in the midst that he had always said if anyone messed with her in any type of way, sexually or anything, that he would kill them. So he found out that Kurt had slept with her 3 times. And so he sent home to his brother and asked his brother to bring a gun down because he was being harassed and stuff, which his brother, when he got there, found out the story wasn't true and asked him why did he have him come down for something like that. So in the midst of it, his brother said he was ready to leave. And as they went out the door, Ja'Kai followed Deshaun, Kurt, and Carl. And him and September had it out. And Carl told him, man, that's what you should have been doing in the first time. You should have been confronting her. And so in the midst of it, Ja'Kai pulled out the gun and shot Carl in the head 1 time. Ja'Kai himself said he hopped, skipped, and he jumped. He went around to the other side of the car where Deshaun was sitting. And Deshaun was trying to get out the car to jump over the fence, but he couldn't make it. And so Ja'Kai hopped, skipped, and jumped, he said, and he shot Deshaun in the head 1 time. Evidently, Kurt must have froze because he couldn't start the car, he couldn't do anything, he couldn't get out the car. And so he hopped, skipped, and jumped in the back, and he shot Kurt 3 times. His statement was that he shot Kurt 3 times because this was how many times he was supposed to have slept with September. So in the midst of this, she got scared and asked him why did he kill them like that. And he told her, you said they was bothering you, and I've always told you no one was going to mess with you. So she got scared, and as they was running around that night trying to find somewhere where to be, she called the police when he fell off to sleep and turned him in and told him where they was going to be at and how the police can catch him. So in the midst of that, a young guy came and knocked on my door and said, Mona, has Deshaun made it home yet? I said, no, babe, he's not here yet. He said, I think you need to come because the car they was in, some people is by there and it doesn't look good. And so I got up. My son then was trying to get me to stay because I was sick, and they said, Mama, we'll go. Everything's okay. Said we were just around there and everything was fine. They waited till my oldest son had left from around there to do all this. And she had claimed, she was telling people that Deshaun was a murderer. He had stabbed people in the neck with a pencil and had killed them. And she just hyped everything up just to get Jekiah riled up. Anybody know Deshaun? Deshaun had never hurt anyone. Deshaun was a lovable child. He loved karate, and he would play karate with the kids and stuff. And it was just so much happening. It was 3 of them, and all of them was killed. What was so sad about everything, that the police wouldn't let none of the mothers go around there. They wouldn't tell us what happened. It was 2:30 in the morning. We didn't find out till 5. So, and it went on and on and on.
Marna, thank you. We have Dr. Hargarten here. What I find fascinating about his work is that he can describe, gun violence, and he can look at it in sort of the network in which it exists. And, you hear nowadays many people talking about it as a public health crisis. And in fact, it has many traits of infectious disease. So Dr. Hargarten, if you don't mind, would you talk a little bit about how gun violence does work that way?
Well, I think we just heard 2 cases of how it does work out, and my extended condolences to both families. Justin's right. I do view this as a public health. I view this as a biopsychosocial disease. Bullets enter into bodies, and they impart their kinetic energy, and they disrupt organs, and they bleed. There's tearing, there's fractures, there's brain swelling, and there's death. That's a biopsychosocial disease burden. And a distinctive feature are the ripple effects of those deaths and injuries that permeate through the families that we've just heard about and throughout our communities. Cities have got to get this right. Just like infectious disease ravaged cities decades ago, cities came together and said, we need to do something about these disease outbreaks. They were largely biological in origin. The disease outbreaks in our cities is kinetic energy from a bullet. And I think what's so important about this work here at the College of Journalism is it's so important to frame these events properly and not extend myths that distract from the conversation. And the myth of guns don't kill people, people kill people, that's a mythological, unscientific statement. And we just heard from Justin about the change of the guns, which results in the change of the bullet's caliber and the size of that caliber, 9 millimeters, do inflict greater damage to a human's body. And we've seen this since the 90s when that transition took place. More people are dying at the scene because there's more energy imparted to the victim, whether it be one bullet to the head or multiple bullets. So this is a disease pattern that we need to understand, and we need to have a discussion that is broad and scientifically based to get at all the kinds of factors that we can do something about, whether it be convoluted relationships, high-risk areas in cities, and the product linked with that, just like we've done with other products linked with bad outcomes, such as cars. I will end by saying I don't want this audience leaving with thinking that there's a myth about trauma care. We take care of patients every day, sometimes with gunshot wounds. We are doing extraordinary work. Justin's right in his observation. We may have reached a plateau. That's why we have to prevent this energy from being transmitted. We have to prevent that bullet from leaving the gun. So what are the strategies for having that happen? Those need to be discussed and framed in a scientific, civil discussion like we would do any other disease.
Thank you, Doctor. And to be clear, out of many people that I've met here, trauma surgeons are some of the heroes. I mean, to know what they're going through, they're working so hard. In some cases, you have two working on a person simultaneously because people are shot with so many bullets. One has hit an artery, one has hit a heart. So, they're doing the best they can. So, unfortunately, I think that we are at time. Do we have time for? We do have time for a question. So, if you'd like a question, or anybody have a question for our panelists, we'll go with those first. And if you have a question for me, I can take those after, or if there's time, I will take them as well.
Well, my question was for you.
Okay.
Sorry.
Okay.
So what, you talk about the lack of data. What role did Congress have in cutting ATF's funding for data collection, and how does that affect what you were looking at?
Yeah, that's the big thing, is this sort of a research. It's not really a ban, but what happened was the CDC was actually studying sort of gun violence, and one study was out about guns in a home and how that was linked to either more sort of accidents that occur as well as sort of shootings. And the NRA and congressman who was sort of aligned with that line of thinking felt that it was a biased study, and from there sort of was able to sort of shut down funding for gun research to the CDC. And that caused a chilling effect, and what that chilling effect was, if there were universities that were studying sort of gun violence research, the lawmakers would sort of lean on them and say, well, if you want to study this, we're going to freeze out, money elsewhere. So essentially what occurred is there's been sort of this freeze in research funding that needs to be reopened. And the story, my third part of the story, which runs today, talks about that and how that needs to be opened. So you have data gaps from police who are not tracking shootings and the FBI who doesn't require it. And then you have the data gap of this freeze in research.
So if I may comment about that, since I was receiving monies from the CDC at the time of that switch that took place. It is not restricted that the CDC cannot do gun-related research. The caveat was that you couldn't use research monies to advocate for a policy based on the research that you just published, so that you're advocating for policy AB 25 using CDC funds. That was not allowed. But Justin's correct. That did send a chilling effect to the leadership of CDC. There were no explicit opportunities. That continues to today. President Obama has requested $10 million for the last 3 years in Congress, and Congress hasn't okayed this. There is that politicized aspect of this biopsychosocial disease burden, not unlike what we saw in HIV in the early 80s, where it was described research was limited and not funded. We are seeing some movements in that over the last couple of years, but still there is that gap in studying this disease. And this gap is as wide as ever seen in a very, very contentious, vexing disease problem.
Hi, I'm Teresa. So I'd like to thank both of the family victims for coming and sharing your story. I'm also wondering about your experience sharing with Justin, the other research assistants on this project, and whether it was sharing your story brought any resolve for you or justice you feel like given your situation.
Well, for me, thank you. I'm at the point now, at first when it happened, I had to pray for strength. Now I'm praying for justice for Anthony. And I'm also at the point where I'm saying I have to speak for Anthony. So, I was glad that Justin came down and we talked, and it helped a lot. And, a lot of things Justin couldn't put in the story because my son's crime hasn't been solved yet, so he couldn't, go and investigate or, get the facts on a lot. So, but I am speaking for Anthony now.
When I first met her, she wouldn't describe what happened to him as getting killed. She would say he got hurt. And she probably still says it because she can't say it.
He got hurt, that word murder, and it just was too harsh for Anthony. So I would just say he got hurt.
And obviously with Marna, she's taken it upon herself to speak for a lot of these mothers who are out there in Milwaukee. In many cases, they don't, they are scared or afraid to cooperate with police. Well, she says, come to me, talk to me. I'll keep your anonymity, and I will speak for you.
Beyond the actual human toll, there's countless murders. What is the actual dollar cost for? I guess we'd be talking about the non-fatal shootings. What is the dollar cost? Because there's obviously medical costs, and I'm sure many people don't have insurance that covers this. And how much of that is if you've done any research on this, how much the taxpayers pick up for these costs?
I mean, the costs are in the millions of dollars, and actually they are increasing because of this. I think we were able to sort of pin down a little bit in Maryland what's going on. They keep kind of going up. So yeah, there is the cost is in the hospitals, and what you see happening is that they hire more staff. There's more trauma surgeons that are needed. There's somebody who needs to be on staff to when that emergency room is needed, an ambulance is coming, somebody to get the OR ready. There are costs in supplies. There are, a lot of these, when you're shot multiple times, you require multiple, gauze and different things like that. And then you have bounce backs, and what they call that is they can only get you to a stable condition. You go to a lesser unit like an ICU, but then all of a sudden something decreases in your back, and that's more supplies and more life support and more different things. So the cost is increasing with the bullets, because the clear impact is that you are more hurt and more parts of your body are hurt, and that requires neurosurgeons if you got shot in the head, or a cardiologist if you got shot in the heart. So the toll is clear. It's pretty tough to get accurate information of how much it affects nationally. It's another sort of gap that's missing. Not all hospitals essentially report to, I think, a national database. Dr. Hargarten would know better, but it is increasing.
So if I may add, the annual cost of taking care of an individual whose spinal cord is severed from a bullet is about $100,000 per year, largely covered by governmental sources, Medicaid. So if you think about the lifetime of that individual shot at age 20, they live to age 50, 60. You can do the math. It's millions of dollars for that one victim. And in some cities, gunshot wounds to the spinal cord is a leading cause of spinal cord injury in those areas, not motor vehicle crashes or falls. Two, Jens Ludwig and Phil Cook published a study comprehensively estimating that the annual cost of gunshot wounds in the United States is exceeding $100 billion per year. Not only the medical costs that Justin has alluded to, but you think about the other ripple effects of lost workdays of the individual who does survive, the lost workdays of those family members who are caring for the victim. All those ripple effects account for a significant toll and a significant cost of this disease.
We have time for one more question.
I really appreciated getting the chance to hear everything. My question is, Justin, and perhaps Dr. Hartigan could chime in on this, is you identified the fact that more powerful weapons with more bullets were a factor in the increased lethality. But can you just speak, I realize you may not know all the reasons, but how did these weapons become more available in the streets? Was it that they evolved into new forms, or were the manufacturers marketing them in new ways, or restrictions limited? Just speak a little bit to what, because if you don't know what's causing it, then you, Dr. Hartigan, talked about we need to, if you understand the forces that are pushing it in, then it would seem that's where you would attack to start reducing.
Sure. I think what you've seen here, and this is coming from police and also from other researchers, but if you look at the number of guns that were manufactured since President Obama took office, it is, unbelievable. It is so much more than the past 20 years previously, the rate of guns that were manufactured. And why is that? I don't know. After Sandy Hook, after that, because there was so much talk about gun control, many gun buyers felt they needed to grab up guns while they could, because maybe they were going to get them taken away. But anyway, so there's this increase in manufacturing. Clearly that translates to an increase of sales. Eventually that trickles down to guns getting in the street. Another thing is a lot of the concealed carry laws that have been passed actually opened up a new market for gun makers, and that is the subcompact gun. Back in the days, a small gun would hold maybe 2 bullets or whatever, but now they can make these small, subcompact guns that are 9 millimeters and can hold many more bullets and things like that and are very powerful. So that's sort of an increase. That's sort of another reason how it's happened. And then, even things like in Maryland, they banned Saturday night specials, which are cheap, low caliber guns, because back in the 80s and 90s, those were being used in crimes. So those aren't being made anymore, and instead it's these expensive sort of high-powered guns that are. But maybe Dr. Hargarten,
So thank you. Chiming in quickly, I learned a lot from Monty Lutz, who was the firearms expert at the crime lab here in Milwaukee. When people are considering buying a handgun in this case, they look to police. What do the police use? They use the 9mm Glock. They've been doing that, and that transition occurred starting in the 90s. So when an individual is thinking about buying a gun for protection or for some nefarious plan, they look to what are the police using? They're using 9mm. They're using semi-automatic pistols. And that transition did take place, and Justin's right about this change in the types of handguns linked with, in this case, homicides, appearing to change, largely because the manufacturers know they're saturating the law enforcement market. They have a civilian market to turn to, and they do that just like any other company would do to sell product. So we're seeing that trend, but that's the basis, Monty Lutz says, when the manufacturers saturate law enforcement and the military, their primary marketplace, they turn to the civilian market to look for new opportunities. And in the New York Times just today, there's talked about the fact that more and more people are buying handguns for self-protection than ever before. That was just an article released today in the New York Times. Sorry, Milwaukee Journal-Sentinel, but it was in the New York Times.
All right. Well, I wanted to thank everybody again. I'm very honored that you were here to listen to this. Thank you, especially that you listened to the stories of these mothers. Their stories still touch me. During this whole project, the one thing in my mind was always that I made sure that they were represented and that I didn't mess up anything with their stories, because these are the people that are speaking out against something that really is a public health crisis here. So anyways, thank you all for being here.